Hey y'all, my name is Dr. Sarah Bober and I am a chiropractor at Full Life Chiropractic in Tampa, Florida. And today I want to talk to you about prenatal chiropractic care and how seeing a chiropractor during your pregnancy can not only help to eliminate many of the aches and pains that are common in pregnancy, but can also facilitate a smoother birth and decrease labor time. So some of the frequently asked questions that most people want to know, we'll just get those started right off the bat. So the first one is it safe? And chiropractic care is extremely safe. There are almost no contraindications to care. And during your first visit, we will do a full exam and assessment to make sure that it is safe. A lot of the adjusting that we actually do in the office, especially for pregnant women, because there's so much hypermobility in the joints, is actually not a lot of popping, twisting, and cracking, and super duper gentle that uses instrument and a lot of soft tissue releases. Second one is how often should I get adjusted, or how soon should I come in, when should I start? And so the best time to get adjusted is when you start thinking about it. But we see moms all throughout their pregnancy, and we even see them preconception. And so it's really just whenever you're comfortable. But if you're at a point where you're feeling these aches and pains and you're having discomfort, that's definitely time to get started. If you're feeling good and you know that you want to maybe have a natural birth, or you don't want to use any pain medication, maybe you had a breech birth in the past or birth trauma, and you want to try to avoid those things, those are all reasons why you should get adjusted sooner. You want to get adjusted on like a wellness basis when people are just coming in just to kind of maintain their health and handle things as they come up. That's like a 1 time a week frequency. But if you're really having issues that we need to work to relieve, then typically people come in about 2 times a week or so. The next one is, do we turn breech babies? This is a common misconception because people think that the Webster Technique is to turn babies, but that would be considered practicing obstetrics. And so chiropractors do not do anything to the babies during the adjustments. We actually work with the space that the baby lives in. And by balancing the joints of the pelvis, the ligaments, and the muscles, we are able to provide more space for baby to get in the position that's best for them. But we're not actually doing anything to the baby. In medicine, they have something called a external version, which is where the doctor will actually put their hands on the belly and try to turn the baby, but that's not what we do here. The next one is, how soon should I come in postpartum? And I'm just moving my screen thing so that I can see my face so that I'm not looking in the corner. The next one is, how soon should I come in postpartum? And so this one, again, is really whatever you're comfortable with. All the moms that are under care in our office get a complimentary postpartum visit for mom and for baby that they can come in whenever they want to. We really want to allow mom to have that 40 days of sacred rest after birth and really just have this lying in period as fully as possible. But we also do see a lot of babies who have issues that, if they're not addressed in those first couple days or first week of life, really morph and manifest into some not so fun things. Things like colic and constipation, difficulty latching, discoordinated suck and swallow patterns, difficulty sleeping, that kind of thing. And so we really recommend that you either come home or come in on your way home from the hospital or from the birth center, or that you come in as soon as you can. So if you're getting out of the house to see your pediatrician, you should definitely be coming to see your chiropractor as well. So that answers the next question about when you should bring your baby in. Really, whatever you're comfortable with. The adjustments for babies are super light touch. It's the pressure you would use to touch the back of your eyelid or to check the ripeness of a tomato. So these are some symptoms that we see in our office, and so common versus normal. And so a lot of people think that pregnancy aches and pains are just a normal part of pregnancy, and it doesn't have to be that way. They're super common, but they're not super normal. And so these are things like low back pain, sciatic pain, piriformis pain, which is pain in your glutes, in your bum, that may or may not go down the legs. A lot of this is due to the change in center of gravity during pregnancy. And so there's specific exercises and adjustments that can help with this. Another one is round ligament pain. As the uterus gets bigger, the ligaments that support it and tie it into the pelvis have to work really hard to keep the uterus in the right position, and they can become overworked, especially if the joints of the spine are not working properly. Another one is reflux or indigestion. You produce less stomach acid while you're pregnant, and the stomach actually pushes, or the baby actually pushes up on the stomach, which can affect the way that food is being digested. So not only do we adjust the joints that affect the stomach, because the spinal nerves travel from the brain down the spinal cord, out the spine to every cell, tissue, and organ in the body. So we can adjust certain areas to have an effect on the stomach. But we also take the body from a state of fight or flight to a state of rest and digest, where digestion is prioritized. That makes a huge difference. And then there are dietary changes and supplements we can recommend as well. The next one is difficulty sleeping. This is typically due to aches and pains, being unable to get comfortable. So either you're having that fire crotch sensation where you're having that pain at your pubic bone, or maybe your round ligaments, low back pain, and like pain down the legs. A lot of that can cause sleeping issues. And so improved sleep is one of the most common things that we see during pregnancy. The next one is constipation, or I skipped constipation. This happens a lot during pregnancy. And when we stimulate the nervous system to relax, a lot of times digestive symptoms improve as well. Headaches and upper back pain. So as our breasts get larger to prepare for breastfeeding, regardless of whether you plan to breastfeed or not, your body, your biological system is going to start that process anyways. So your breasts will get larger, which can sometimes cause your shoulders to hunch forward, which can cause that pain kind of between your shoulder blades. This can also cause your head, so your head should be nice and stacked with your ears over your shoulders. It can cause your head to pitch forward, which can cause the muscles of your neck to work harder than they need to, and that can lead to neck pain and headaches. All right, so what are the benefits to getting adjusted through pregnancy? So a lot of these issues that I just discussed, a lot of those will decrease. So things like low back pain, sciatic pain, pubic pain go away or significantly decrease. If you're having pain with movements, either pain turning over in bed, getting out of the car, walking, all those things are going to get so much better. You'll be able to sleep without pain. Nausea will decrease. Because you're sleeping better, your energy is going to be better, your digestive system and the reflux will improve, and then less headaches and less upper back pain. So you might have heard this buzzword before. The Webster Technique is the technique that we use to adjust pregnant moms. So the Webster Technique is something that was created by the ICPA, which is the International Chiropractic Pediatric Association. And so not all chiropractors can adjust pregnant moms, but not all chiropractors are trained in the Webster Technique. So we have our little plaques here in the office. Proficiency, this is backwards, in the Webster Technique, and all 4 of the doctors in our office have that certification. So what we're doing is it's a gentle and specific technique that's aimed at balancing the ligaments, muscles, and joints of the pelvis. And so like I said before, it doesn't involve a lot of popping, twisting, or cracking. It can be none of that if that's your preference. We'll see a video here shortly that will kind of show that more. We can use a drop table that will help to kind of put those joints in motion. We have blocks that help to rebalance the pelvis. Because we're working with the muscles and the ligaments, we're going to have some different levels of soft tissue techniques as well. So how does it work? So there's 3 main goals of getting adjusted during pregnancy. The first one is the power. And so your brain, your spinal cord, that's protected by your skull and your spine, right? And those nerves travel from your spinal cord out of every joint to every cell, tissue, and organ in the body. And that includes your uterus and your pelvic floor. And so actually, a big misconception is that a lot of people think that their pelvic floor is what pushes the baby out, but that's actually not the case. We want your pelvic floor to be relaxed, and your uterus is what pushes the baby out. In any case, we want to make sure that the organs and the muscles of your reproductive system are getting the proper nerve supply from your brain down your spinal cord, out those nerves to those muscles, so that you can have the most powerful contractions, and that things can open up beautifully the way that they're supposed to, so the baby can have a smooth exit. The next one is the passage. And so the passage is what the baby travels through. So this is a gigantic spine. This is your spine. So this is your pelvis here. So you have your pelvic bones on the side, and then your tailbones here. And then you have your pubic bone at the front. So when baby is being born, they're going to travel down this space. They have to turn through here and exit out the bottom, right? And if there's any misalignments in here, like on this model, looks kind of funny. If there's any misalignments in here, that's going to interfere with the baby being able to get out smoothly. So by aligning the joints and the soft tissues of the pelvis, we can improve the space that the baby needs to travel through and help to make things as streamlined as possible. One of my mentors says that we want to take this from an obstacle course to a slippery slide. Next thing is the passenger. So this goes back to, we're not adjusting the baby, but the baby is growing and developing in this space within mom. And while we're not adjusting the baby, we're working with the space around them. So balancing the pelvic ligaments, the musculature, and the joints provides the most amount of room for baby to grow, develop, and get into the best position. And so you may have heard of issues with latching, head shape, or torticollis, where the babies can't turn their heads fully. Sometimes a lot of that has to do with how they're positioned in the pelvis and the amount of tension and torsion that they're under. All right, so this is a video of what an adjustment looks like during pregnancy. So this is Dr. Enrico. He's the owner of our office, and you can see here how he is adjusting. So I'll kind of explain this. It's going to hopefully start again. So let's see here. All right. So first we check the leg length. So the leg length is a big indicator of tension in the spine and in the spinal cord. Then he is doing some pressure tests to figure out where we want to adjust. This is a specific technique to check the sacrum. When you push the heels towards the buttocks, we want to see if one side is more resistant than the other. It's hard to see here, but the left side is more resistant. So he's going to adjust that in a second with a little drop and a little clicker. Then he's checking up the rest of the spine and adjusting there. When we turn over, he's checking the round ligaments, and then he'll check the pubic bone. And then he does an adjustment to the neck, kind of a traditional style adjustment here. Those are super gentle. We can also use an instrument. I typically use an instrument to adjust the neck, and it works just as well. And then you can see he does a little bear hug adjustment to help with that upper back tension. So you can go back and watch that. It goes pretty quickly. This is obviously sped up, but the adjustments typically take about 5 to 10 minutes in the office. Cool. Also, if you check out my Instagram, Dr. Sarah Bober, I have a couple of videos on there of more pregnancy adjusting. All right. So let's talk about the anatomy of the pelvis. We've kind of shuffled back and forth talking about this a little bit, but let's get into a little bit more. So your pelvis has 3 main joints. It has 2 on the side here. You have your tailbone. You have 1 joint here, 1 joint here, and then 1 at the front here. So the sacrum, your tailbone, needs to move fully during the birth process in order for this space, the pelvic inlet, to open up. Once baby gets down into the birth canal, we want it to move again so that baby can get out the bottom, right? So we're going to be adjusting the sacrum, which is the tailbone here, to see if it's got any rotation in it. We'll also adjust the pubic bone if it needs to be adjusted. We'll check the ligaments. There are some ligaments back here. This is the sacrotuberous ligament that goes from the sacrum to the ischial tuberosity of the pelvis. And when that gets tight, it rotates the sacrum. So we want to adjust that. Actually, adjusting that also helps to stimulate the rest and digest part of your nervous system, which is really great for sleep and stress and constipation, that kind of thing. The next thing we'll do is check the muscles. So the muscles aren't pictured on here. There is a muscle deep in the hip that causes the hip to go into flexion and come like when you bring your knee to your chest. And so that muscle travels deep behind the uterus here and can pull on the lower back and also pull into the hip. Then we'll check the piriformis, which is a muscle deep in your glutes, which actually the sciatic nerve travels right near or in through that muscle. And if that is tight, it can cause some really not so fun nerve pain. All right, so the nervous system. So we just went over the biomechanics of the spine. And when we're adjusting, not only are we adjusting the pelvis, but we're also checking the whole spine, because the spine is getting information, or the brain's getting information from the spine about where the body is in space. And the more accurate that information is, the better it's able to coordinate. So the next thing here is the nervous system. So the spine protects the nervous system. The nervous system tells the body what to do. It controls and coordinates every system in the body. And a lot of people, because of modern life, are shifted more into our fight or flight stress response. And your body doesn't know the difference whether you're running from a tiger through the woods or a bear, or whether you're just running late for work and your kid is stressing you out and your spouse isn't home yet, and we're in a global pandemic. All of these things put our bodies into a state of stress. And so when you're choosing where you want to birth and who is a member of your birth team, that's one of the really important things to consider. Is, are there going to be really bright lights? Are there going to be strangers in here? Are you going to be poked and prodded and have unnecessary monitors and interventions? Or are you going to be allowed to birth in peace and maintain that restful state while you birth? And so if your nervous system is in this amped up, tense state, it's going to cause your pelvic floor to be super tight. And like we mentioned before, we want to let that baby slide through the pelvis and not face the resistance of the pelvic floor. So if you're in a more restful state, that's going to affect your muscle tension, going to allow your body to open up better, and it's going to be overall a more pleasant experience. So if you're interested, if you watched all this and you're interested in getting care in our office, you can just mention this video and we'll do a complimentary consultation over the phone with you. If you're like, I'm ready to go, then you just call our office and you can schedule a consultation and exam. So the consultation will basically go over your goals for pregnancy, previous birth experiences, any symptoms that you're having, any other health issues, any trauma, anything like that may affect our care. And then we'll do kind of an exam to figure out how much stress your nervous system is under, what your posture is like, figure out how well your body is adapting to the stressors that are going on. And then you'll begin care. And so our adjustments, like you saw before, are very gentle. Moms, as just a way to keep up with the demands of pregnancy and feel well, typically come in about one time a week. If we have some symptoms that we're trying to decrease, the frequency is going to be a little bit more than that. Usually 2, but it can sometimes be 3 times a week, especially if you're having any positioning issues, if baby is breech, things like that, then we want to be able to make sure everything is as balanced as possible all the time. So we'll give you a care plan depending on what your goals are for care, and that's how it goes. And then you get your postpartum visit for you and baby. So if you have any questions, please reach out. I am Dr. Sarah, and we are Full Life Chiropractic. This is a cool quote that I thought was lovely. Whenever and however you intend to give birth, your experience will impact your emotions, your mind, your body, and your spirit for the rest of your life. Ina May Gaskin, if you have not read any of her books or watched any documentaries with her, highly recommend looking into her. She's a phenomenal midwife up in Tennessee who's really made some serious changes when it comes to birth and just empowering women overall. Birth is such a transformative experience, and if you can really align yourself with the right providers, you can really have a really awesome experience that you don't need to really feel traumatized by. All right, well, it was really great talking to you guys. Have a great rest of your day. Thank you for joining.